Most common cardiovascular diseases. 8th semester B. The higher the blood pressure, the greater the risk of damage to the heart and blood vessels of major organs, such as the brain and kidneys. Hypertension is the leading preventable cause of cardiovascular disease and stroke in the world. The guidelines show that even moderately high blood pressure can significantly increase your risk of developing a disease. Figures above normal parameters are considered hypertension and are classified into 5 stages from normal pressure to hypertensive emergency. High blood pressure, a silent killer difficult to detect until irreversible damage occurs. The lack of symptoms makes the detection of this disease difficult. Except in the case of hypertensive crisis. There are non-modifiable risk factors and modifiable ones. We must focus on the prevention and promotion of risk factors that can be modifiable in order to reduce our cardiovascular risk. Coronary heart disease represents a compromise of the blood flow through the coronary arteries, generated more frequently by the presence of atherosclerosis. Among the most frequent symptoms caused by lack of circulation to the heart are dizziness, dyspnea, palpitations and chest pain. The measures to minimize the chances of suffering from coronary heart disease and its adverse consequences are summarized in healthy nutrition, not ingesting harmful substances, exercise, and control of comorbidities. A stroke is a medical condition in which poor blood flow to the brain causes cell death. There are 2 main types of stroke: ischemic, due to lack of blood flow, and hemorrhagic, due to bleeding. Both cause parts of the brain to stop functioning properly. Knowing the warning signs of a stroke may be the difference between recovery and disability. Learn to think and act fast. Lifestyle factors that increase your risk of stroke include high blood pressure, smoking, diabetes, high blood cholesterol levels, heavy drinking, high salt and high fat diet and lack of exercise. Heart failure can be defined as an abnormality of heart structure or function that leads to the heart not delivering oxygen at a rate commensurate with tissue requirements. Heart failure is the final syndrome of some very prevalent diseases in primary care and can translate in a certain way to failure in their control and treatment.